Hi, everyone. It's fun. It's good to be back here. Our colleague did not make it. We had lots of storms and weather delays out of the New York area, and I think I was like 5 hours late, and Carla was a bunch of hours late, and our colleague's flight got canceled, so we told her we could manage without her. Anyway, but we're really happy that we got here finally. We thought we only have to worry about winter in Vermont weather, but clearly that's not the case. So like Carla said, we got a lot of feedback on our evaluations about how you all found it really valuable to be able to get to know each other and share challenges and success stories. So we're actually going to start off with an activity that's going to allow you to do that in a little bit more of an organized way, we hope. So in your packets, you have a little worksheet that says Connecting with Others, hopefully. Our coordinator's not here, so we won't know what to do if you don't have it. So what we're going to do is I'm going to give you about 10 minutes to really think about the questions that are on this sheet and write down notes. Once you all have completed and have some good thoughts about each of these questions and how you would respond, we're going to break you into 10 groups. We'll count off because I know some of you are sitting with people that you actually work with, and we want to give you an opportunity to get advice and share with people that you don't work with. So after the 10 minutes, again, like I said, we'll count off by tens, divide you in groups, and then we'll ask you to just start sharing your responses to these questions, and hopefully with all of the experience and knowledge in your groups, that you can have a really, helpful discussion. And again, it doesn't all have to be about challenges. It could be about successes. I'm sure you've thought, oh, something really great happened. I bet other people could benefit from hearing this, or how we managed with a particular situation, because we've been hearing that, throughout the training with all of you. So does that sound okay? Okay, so go ahead and get started. If you have questions, just grab us and we'll try to answer them. Thanks. Okay, sounds like when I start to hear a lot of voices, that's my signal that most of you are ready. Okay, so what we're going to do now, in a minute we'll count off and we're going to make 10 groups, and then I'm going to divide. I'm going to tell you where each group is going. So this will be the hardest part of the training for me. So I can use your cooperation and assistance. And then what I'm going to have you do in your groups is start with just the first 2 questions, and then we'll move on from there.
This is really distracting. There's a lot of You're waiting for a call back.
In the back, thank you. Ladies in the back, can I get your attention? Thank you. All right. So what we're going to do now, can anyone guess? Oh, okay. We're going to count off by 10 one more time, and we're going to have you be in groups where you will discuss this last 2 questions, okay? So just one more time of moving. This is good for us. No one's going to fall asleep. So we'll start with, can you be 1? Let's turn our attention to me. Everyone wrap up your thought, or your thoughts. You have more than one. Can I get everyone's attention, please? Thank you. Okay. As with most things, it seems like there wasn't enough time for this. But you can stay where you are for a minute. We just want to hear a couple of, responses or thoughts about each of these. So let's start with the first question. What were some of the challenges that you heard in your groups that seemed prevalent overall? Anybody? Yeah.
I really enjoyed that discussion.
Sorry, you know how we are with the mics.
Hello. I did enjoy the discussion we had. Can you hear me? Is that working? Okay. And we really hit on things concerning system changes, safety protocols, the need to triage, and our caseload.
What do you mean by safety protocols?
What our agencies enacting safety protocols, especially as our cultures are changing, as we saw recently the tragedy with Laura Sobel, and how are our agencies addressing this. What I got out of the conversation was that those social workers and professionals who are working with that particular clientele, where they have a very diverse range of people, are starting to, and do similar type of work, are starting to enact those protocols, whereas other agencies are just kind of touch and go on it, but nothing is really in place. And I think it's a concern for people who work in the profession that we work in.
Does everybody know what she was referring to? Because my friend over here, obviously I don't live here, told me, and I want to make sure everybody, it's horrible. Is there anyone who doesn't know what she's referring to? Okay, someone in the back doesn't. Can somebody just quickly?
She was a DCF worker, and she was killed in, is it Barry? Barry by the mother of a child she was working with. It's been a while, right? Year and a half, 2 years? 1 year?
So you meant actual safety in performing the positions. And what about
Safety of workers.
Yeah, safety of workers.
For people who are qualified.
Right, sure. Did that come up in other groups? So there was some system, you mentioned systems. What system stuff came up for people? So I bet there's more than one person. Yeah, Maggie?
Just one of the challenges is for our office is to connect with other services that aren't in our system. So, and make sure we're not duplicating services, but also make sure that we're lining the patient up with the appropriate services. And it's mostly trying to reach people by phone or by email. There's not a system, just it's individual contacts, and I'm not sure how to make that better. But coming here and sitting around a table with 5 people from different services in this area is really helpful.
Great. So did anyone did anyone have a solution for this, or one piece of a solution that they've been working on and they think would be helpful for others to hear? It was all about how do you communicate, how do you make sure you're not duplicating services, there's no system, it's usually just individual like emails or phone numbers. Anyone doing anything around that? There's someone in the back.
There's a couple of things going on in the state. There's a platform coming out from OneCare for our OneCare patients. They're trialing it in 4 regions. It's called Care Navigator. It is a program that SASH actually is going to use as their primary documentation tool. It's really neat. We are getting an in-service up in Franklin County at one of our big group meetings in a couple of weeks from them. Also secure email, making sure you've got releases that are user-friendly for us and the patients, so they don't have to sign like 50 million things all in one sheet. And just trying to really make sure that you have that neighborhood map, that medical neighborhood map of everybody's contact information, and you can blitz it out to people in a secure email every couple of months to make sure that, yes, I've got your contact information, that it hasn't changed, and make that a clear expectation if you have care conferences or anything else, that people re-update you on what their contact information is. It's hard. It's probably the most challenging piece of it. And that closed loop, right? The other piece is the closed loop, that it comes, that the communication just doesn't go out, but it also keeps getting fed back in from other people, and making that as a clear expectation or an action item of everyone after you meet.
We've started using group emails, a thread that all the providers on the team are receiving the same information all at the same time about clients that might be splitting or seeking different things from different places, so that we are all continuing in this email to say this is what happened with us, so everybody's up to date all the time.
Any other, it looks like we have a hand back here, challenges with solutions. Let me get in the back and then I'll grab you. I just give it to her. Pass that back to Emily.
It's only happened a couple times, but I think there's been joint home visits with other agencies, and then you can just really get to the bottom of things quickly, divide and conquer, and go. It's a lot of coordination on the front end for arranging that and schedules, but it's really helpful with the patients.
Sure. That sounds awesome.
The joint home visits are so helpful, but also just we'll share contacts. And I was just thinking that if there was a way we could just all jot our email down if you're interested, and then make a group. I don't know, we just constantly share contacts of people in different organizations. So if I go into my contacts list, I can look for all the names in CVAA, and I'm like, oh, I need to speak with that person. And just something as simple as having that. And if we, I don't know, we could maybe even write.
You mean from this here?
Sure.
We have, Erin they have a list of everyone here. I mean.
Yeah, if people were.
I guess
that,
you
yeah.
don't want to be on it,
Right.
that would be an easier way, like if you don't want your information.
I would go to Erin if you don't want your information shared.
I don't know. I mean,
That sounds great. I was also, when you were saying that, I was thinking people feel differently about like listservs, but I keep sending stuff to all of our contacts when I find something, and then I'm like, send this to all the care management people. But maybe you want to like start a Vermont care management listserv just to share. It doesn't have to be specific, right, about patients or clients. What other challenges and solutions? And/or solutions? Okay, great. Anyone else want to share? I think we have time for maybe one more.
Did we get any other challenges?
Yeah.
I know
mean,
you want to do successes. I just didn't know if we got.
I asked if people had any more challenges they wanted to talk
That's
about.
it? These are all the challenges you have? I don't believe it.
We have a lot of work for you if that's the case.
Yeah. Lack of caregiver supports, meaning for the people. Tell me, yeah, say more about that.
Agencies don't have staff to fill the gaps, so then clients start moving down the chain from independence to hospital to swing bed to nursing home.
What I mean is, when you say
There's a lack of people to fill the gap, to fill the needs.
when you say
Whether-
caregiver, do you mean a family or support person, or do you mean like a care coordinator, care manager person?
A direct hands-on person, a PCA, to work with individuals who have needs.
Okay, so more health workforce issues is what you're talking about, not lack of support for the family or support people who work with patients.
Support for the family. Right. So we've talked about a lot of different things. So I have a client who got discharged from adult day because of aggression, went home, there's no staff to help her at home with her choice of her care. So now she's in a swing bed, and nursing homes are declining her because of various reasons. So what happens, this all started with a caregiver issue, that there weren't the PCAs.
Right, and so in an ideal world, you'd have a PCA to go home with that person, or what would your best solution be for that?
In Vermont, we have a program called Choices for Care
Okay,
that pays for people to have care at home.
okay,
I've been with providers who have told families that some of the time, like companionship time, is a luxury, and that they can't fill what their PCA time is, so don't even ask us for companion time, when that's all part of the package that we're presenting to them as something to support them.
okay, I'm
So those
understanding.
people are there.
So it's the HOC that.
So there not enough people to fill the positions, or not enough money?
It's a nationwide issue.
Right, and of course, on the back end, right, these people then end up in much more acute care settings, which the state ends up paying for anyway, right? So Right, so that doesn't make a lot of
There's someone in the back
sense.
who wanted to say something. Go ahead.
I was going to piggyback on what Rebecca was saying, and that is that we're supposedly restructuring programs to be, client-centered and personally responsibility, and yet most of the programs are not moving in that direction, at least from the state funding level. None of the programs are client-centered at all. It's we're trying to do what we need to do, but the programs are not designed to facilitate that. So you bang your head against the wall, fighting the system, and not addressing the wellness of,
Right.
of the consumer.
Because they don't qualify.
Exactly. Yes. Or it's not. It's not exactly what they. What's your analogy, Beck? You said like you want a hamburger and French fries, but
Right, if you're in a restaurant, we all serve hamburgers, fries, hot dogs, and onion rings, but you can only get hamburgers and fries or hot dogs and onion rings. And if your client needs a hamburger and onion rings, you're really up the creek, even though we all provide everything.
yeah, yeah.
Okay. Any solutions to that? And then we had one more person. Go ahead.
I was just talking about the stresses on the long-term care Medicaid system, and really the choices are limited to the home health agencies. There's been talk in the state for many years about whether they would let some of the private care agencies participate in the programs. In this county, which is pretty dense, there's a over 300-person wait list for the moderate needs homemaker program. So, you offer people services, you're offering them a waiting list. And so here's where I think we've got a lot of creative people in this room, and people work really hard to come up with these solutions. I think our teaming is good because it helps, but the systems there's some big system changes, and the state knows this. It's sort of, ongoing, these struggles. So, when you hear these frustrations, it's because we see people sort of crumbling, right before us.
No, so this is just really selfish on my part because I want to learn, but can you this thing about we have all these services but people don't qualify, can someone just very succinctly tell me, is it that people are not sick enough, or is it, what is it that are keeping people from qualifying for all the services or any services?
The long-term care, Choices for Care is the Medicaid waiver program. They call it Choices for Care.
Yeah.
And there are clinical and financial criteria, and really specific, you need to meet a couple of extensive to total needs and ADLs for the highest level on Choices for Care. If not, you're looking at potential criteria for the homemaker program.
So it sounds like you need people who are extremely sick, right?
Nursing home level of care.
Nursing home, okay.
Yeah.
So what we're not addressing are the kind of, they're sick or they're very much at risk, they're high risk, but they're not at the nursing home level yet, right? That level right below.
So then below that, moderate needs, we are so stretched with
Yes.
these waiting lists and funding and.
Right.
Yeah.
And
Right.
I think that it's not that they're below the nursing home level of care. The major emphasis is that it makes sense both personally and financially to keep people out of nursing homes. So they
Absolutely.
are at the nursing home level of
Right.
care, but we're able to provide the same services
Yes.
that they would get
Right.
in the nursing home, in the home.
Right. And this is where
And
the
then
system
that's
hasn't
where
changed.
all the breakdown starts to happen.
Yeah.
That's being talked about.
Right.
That we don't even, we are mandated to provide these plans
Right.
for certain people who qualify, and yet we don't have the manpower to
Yeah.
back those plans. And
Right.
so it becomes extremely frustrating for the case manager who's trying to manage those
Right.
clients.
Right.
The inequality in the home-based setting is that the nursing home and residential care homes are 24-hour settings. Home-based is not. There is an inequality, even though it's supposed to be an equal choice
Right.
and an equal transition between settings. It becomes very challenging for people to accomplish that at home, and that's really where most people want to be, obviously.
Of course, right. So as we move from, the old model, right, where everyone was put in a hospital or a nursing home or in this that kind of setting, right? We don't have the resources to provide that care or the training or the culture or whatever to provide it in their home, but obviously that's where we want to move. I don't think Vermont is alone in that. I think other states are facing this as well. But there are some in New York, just as an example, we now have a program for people who are what I would call sort of that level right under, right, who have one chronic condition and Medicaid, and they can get services. So anyway, I hear what you're saying.
Did you want to say one more thing, and then we're going to close out?
I think in all the groups we just heard about communication and job roles and definitions and who's to communicate with who about what. You know, the case managers or lead care coordinator is one person in charge, and then how do people know who to get back to about what information and timeliness and, you know, email or not, or through an EMR. So just communication in general.
Yeah. Anyone have something different, innovative that they're doing around that? And then we're going to move on. So, I mean, it sounds, I mean, everywhere I go and any training I do, it's always communication seems to always be a big thing about how people get back to each other and when. And I'd like to say that we have like these perfect solutions for them, but I think that's just the nature of doing any type of teamwork, and it's more challenging if your team member is not sitting next to you. So as you figure out solutions and things like that, or something that works, hopefully we'll have some sort of listserv set up and you can actually share with people. And it sounds like there's some new platforms as well maybe coming out that will help with that. But yeah, I agree. Okay, so this is actually a good segue.
Yeah.
We're going to be talking about transitions of, actually just one more question. Did people find this helpful overall? Raise your hand if it was, generally helpful to you. Okay, good, because we also used, we wanted to know if we should do this again with another group. Okay, I'm glad it was helpful. Again, I know there wasn't enough time, but feel free to continue your conversations over the break and at lunch.